In the fast-paced world we live in, stress and anxiety have become all too common. To combat these overwhelming feelings, many people turn to medication. Two popular options for anxiety treatment are Xanax and Lexapro. Both medications have proven to be effective in managing symptoms, but which one is right for you? In this video, we will explore the battle of the pills, Xanax versus Lexapro, and help you make an informed decision. Xanax, a benzodiazepine, works by calming the central nervous system and providing immediate relief for anxiety symptoms. Lexapro, on the other hand, is an antidepressant that increases the levels of serotonin in the brain over time, leading to a gradual improvement in mood and reduction in anxiety. But choosing between Xanax and Lexapro is not a matter of preference. It's about finding the treatment that suits your individual needs and circumstances. We will delve into the pros and cons of each medication, as well as consider factors such as side effects, potential interactions, and long-term use. If anxiety is taking a toll on your daily life, it's important to find the right treatment. Stay tuned as we compare Xanax and Lexapro, and guide you towards making the best decision for your anxiety management journey. Understanding anxiety and the need for treatment. Anxiety is a natural response to stress and can be beneficial in certain situations. However, when anxiety becomes excessive and interferes with daily life, it may require treatment. Anxiety disorders are among the most common mental health conditions, affecting millions of people worldwide. Living with anxiety can be challenging, as it can manifest in various ways, such as excessive worry, restlessness, irritability, and difficulty concentrating. It can also lead to physical symptoms like rapid heartbeat, sweating, and shortness of breath. If left untreated, anxiety can significantly impact one's quality of life and overall well-being. Fortunately, there are several treatment options available, including therapy, lifestyle changes, and medication. While therapy and lifestyle modifications play a vital role in managing anxiety, medication can provide relief for individuals experiencing severe symptoms or those who have not found success with other forms of treatment. Overview of Xanax and Lexapro. Before diving into the specifics of Xanax and Lexapro, let's take a closer look at each medication and how they work to alleviate anxiety symptoms. Xanax. Xanax, also known by its generic name alprazolam, is a benzodiazepine that belongs to the class of central nervous system (CNS) depressants. It works by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain, which helps to calm the nervous system and reduce anxiety. Xanax is primarily prescribed for the short-term treatment of anxiety disorders, panic disorders, and anxiety associated with depression. Unlike selective serotonin reuptake inhibitors, SSRIs, like Lexapro, Xanax provides immediate relief, often within 30 minutes to an hour after ingestion. It is available in tablet and extended-release forms, and the dosage is typically tailored to an individual's needs. Lexapro. Lexapro, also known as escitalopram, is a selective serotonin reuptake inhibitor, SSRI, antidepressant. It works by increasing the levels of serotonin, a neurotransmitter that regulates mood, in the brain. By balancing serotonin levels, Lexapro helps to improve mood and reduce anxiety symptoms over time. Lexapro is commonly prescribed for the long-term treatment of generalized anxiety disorder, GAD, and major depressive disorder, MDD. It is available in tablet and liquid forms, with the dosage typically starting low and gradually increasing based on the individual's response. How Xanax works as an anxiety treatment. Xanax is known for its rapid onset of action, making it an effective medication for individuals seeking immediate relief from anxiety symptoms. When taken as prescribed, Xanax binds to GABA receptors in the brain, enhancing the inhibitory effects of GABA and reducing the activity of neurons responsible for anxiety. The calming effects of Xanax can help individuals feel more relaxed, reduce excessive worrying, and alleviate physical symptoms of anxiety, such as rapid heartbeat and shortness of breath. It is commonly prescribed for short-term use during acute anxiety episodes, panic attacks, or situations that trigger intense anxiety. However, it's important to note that Xanax is not a long-term solution for anxiety management. Due to its potential for dependence and abuse, it is typically prescribed for short durations, ranging from a few days to a few weeks. Prolonged use of Xanax can lead to tolerance, meaning higher doses may be required to achieve the same effect, and abrupt discontinuation can result in withdrawal symptoms. How Lexapro works as an anxiety treatment. Unlike Xanax, Lexapro is not designed for immediate relief of anxiety symptoms. Instead, it works gradually to rebalance serotonin levels in the brain, leading to a reduction in anxiety and an improvement in mood over time. This makes Lexapro a suitable option for individuals seeking long-term treatment for anxiety disorders or coexisting depression. Lexapro takes several weeks to reach its full effect, as it needs time to build up in the body and for serotonin levels to stabilize. It is important to consistently take Lexapro as prescribed, even if immediate improvements are not noticeable. Missing doses or discontinuing Lexapro abruptly can lead to withdrawal symptoms and may affect the overall effectiveness of the medication. The gradual nature of Lexapro's action can be beneficial for individuals who prefer a more stable and sustained treatment approach. It allows for a consistent level of medication in the body, which can help manage anxiety symptoms in the long run. Comparing the effectiveness of Xanax and Lexapro. When comparing the effectiveness of Xanax and Lexapro, it's important to consider the specific needs and circumstances of each individual. Both medications have been shown to be effective in managing anxiety symptoms, but they differ in terms of onset of action, duration of treatment, and potential side effects. Xanax is highly effective in providing immediate relief for acute anxiety episodes and panic attacks. Its fast-acting nature makes it a suitable option for individuals who require immediate symptom relief or those who experience anxiety in specific situations, such as public speaking or flying. However, Xanax is not recommended for long-term use due to the risk of dependence and potential for abuse. On the other hand, Lexapro's effectiveness lies in its ability to provide sustained relief from anxiety symptoms over time. It is commonly prescribed for individuals with chronic anxiety disorders or coexisting depression. Lexapro may take several weeks to show noticeable improvements, but it is generally well tolerated and has a lower risk of dependence compared to Xanax. When considering the effectiveness of Xanax and Lexapro, it is crucial to consult with a healthcare professional who can assess your specific needs and guide you towards the most appropriate treatment option. Side effects and risks of Xanax. Like any medication, Xanax is associated with potential side effects and risks that should be taken into consideration before starting treatment. Common side effects of Xanax may include drowsiness, dizziness, blurred vision, and difficulty concentrating. These side effects are usually mild and temporary, but if they persist or worsen, it is important to consult a healthcare professional. In some cases, individuals may experience more severe side effects, such as memory impairment, confusion, and changes in mood or behavior. It is crucial to seek immediate medical attention if any concerning symptoms arise. One of the main risks associated with Xanax is the potential for dependence and addiction. Due to its calming effects, Xanax can be habit-forming, especially when used for extended periods or in higher doses than prescribed. Abruptly stopping Xanax can lead to withdrawal symptoms, including rebound anxiety, insomnia, irritability, and seizures. It is important to follow the prescribed dosage and consult with a healthcare professional before making any changes to your Xanax regimen. Side effects and risks of Lexapro. While Lexapro is generally well tolerated, it can also have side effects that vary from person to person. Common side effects of Lexapro may include nausea, drowsiness, insomnia, and sexual dysfunction. These side effects are usually mild and tend to improve as the body adjusts to the medication. It is important to discuss any concerns or persistent side effects with a healthcare professional. In rare cases, Lexapro may cause more severe side effects, such as increased heart rate, fever, and allergic reactions. If you experience any of these symptoms, it is important to seek immediate medical attention. Another potential risk associated with Lexapro is the increased risk of suicidal thoughts or behaviors, especially in adolescents and young adults. It is essential to closely monitor individuals starting Lexapro, especially during the initial weeks of treatment. Any changes in mood or behavior should be promptly reported to a healthcare professional. As with any medication, it is important to weigh the potential benefits against the risks and consult with a healthcare professional to determine the most appropriate treatment option for your individual needs. Factors to consider when choosing between Xanax and Lexapro. When deciding between Xanax and Lexapro for anxiety treatment, there are several factors that should be considered. Symptom severity and type. Xanax may be more suitable for individuals experiencing acute anxiety episodes or panic attacks, while Lexapro may be a better choice for individuals with chronic anxiety disorders or coexisting depression. Onset of action. Xanax provides immediate relief, while Lexapro takes several weeks to show noticeable improvements. Consider whether you need immediate symptom relief or are willing to wait for gradual improvement. Duration of treatment. Xanax is typically prescribed for short-term use, while Lexapro is designed for long-term treatment. Assess whether you need a temporary solution or a sustained treatment approach. Side effects and risks. Evaluate the potential side effects and risks associated with each medication, and discuss them with a healthcare professional to determine which option aligns with your individual tolerance and preferences. Interactions with other medications. It is important to consider any other medications you may be taking and discuss potential interactions with a healthcare professional to ensure the safe and effective use of Xanax or Lexapro. Personal preferences. Your personal preferences and comfort level with different treatment approaches should also be taken into account. Some individuals may prefer the immediate relief provided by Xanax, while others may prefer the gradual and sustained effects of Lexapro. It is crucial to consult with a healthcare professional who can assess your specific needs, discuss the pros and cons of each medication, and guide you towards the most appropriate treatment option. Alternative anxiety treatments. While Xanax and Lexapro are effective options for anxiety treatment, they are not the only possibilities. There are various alternative treatments and lifestyle modifications that can help manage anxiety symptoms. Therapy. Cognitive behavioral therapy, CBT, and other forms of psychotherapy can provide valuable tools and coping mechanisms for managing anxiety. Therapy can help identify the underlying causes of anxiety and develop strategies to address them. Relaxation techniques. Practices such as deep breathing, meditation, and yoga can help reduce anxiety symptoms by promoting relaxation and mindfulness. Regular exercise. Engaging in physical activity can release endorphins, improve mood, and reduce anxiety. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Healthy lifestyle habits. Prioritize adequate sleep, maintain a balanced diet, limit caffeine and alcohol intake, and avoid smoking. These lifestyle factors can significantly impact anxiety levels. Stress management. Find effective stress management techniques that work for you, such as journaling, listening to music, spending time in nature, or engaging in hobbies. Support system. Building a strong support system of friends, family, or support groups can provide emotional support and understanding during challenging times. Remember, what works for one person may not work for another. It may be necessary to try different treatments or a combination of approaches to find what works best for you. Conclusion. Making an informed decision about anxiety treatment. Choosing the best anxiety treatment requires careful consideration of various factors, including the specific needs and circumstances of each individual. Xanax and Lexapro are both effective options, but they differ in terms of onset of action, duration of treatment, and potential side effects. It is important to consult with a healthcare professional who can assess your individual needs, discuss the pros and cons of each medication, and guide you towards the most appropriate treatment option. It's also crucial to explore alternative anxiety treatments and lifestyle modifications that can complement medication or be used as standalone approaches. Therapy, relaxation techniques, regular exercise, healthy lifestyle habits, stress management, and a strong support system can all contribute to managing anxiety symptoms effectively. Remember, finding the right anxiety treatment is a journey that may require some trial and error. Be patient with yourself, seek professional guidance, and prioritize your mental health. With the right treatment and support, you can regain control over your anxiety and live a fulfilling life.